Hi, hello everyone. Good morning from Nigeria. Uh, Good afternoon, good evening, wherever you're watching from in any part of the world. I made a video recently where I said I would do a separate video to address extensively the recent reported invasion of University of UniUyo Teaching Hospital by the officials of Economic and Financial Crimes Commission (EFCC). There have been subsequent reports that EFCC had investigated and tendered an apology. I think that's good, but it should go beyond that. I wouldn't have imagined that a government agency or anybody at all could carry carry out such an act in a health facility, shot into the air, abducted a surgeon, just created very uncomfortable and traumatic scene, both for their victim and every other person who was in that institution. No one could ever imagine that. I don't know if those guys were on drugs or what, or if, I sincerely would recommend mental state examination, by a psychiatrist to confirm that they're actually normal before even further, perhaps, punitive actions could be considered. And this should be reported to the public. You know why this is significant? We're at a point that, a lot of health professionals do not see our environment as a preferred place to practice, and for various reasons. Some are related to the conditions of work, the relative low pay, and also behaviors like this. A system that treats you, the patient, and the system as trash. And imagine a medical student watching that, happen to a consultant, the most revered professionals in our profession. It takes a whole lot. You do medical school for whatever number of years it might take, out for housemanship, youth service, and you go back for training for probably up to 6 years plus or minus, to become a consultant, become a specialty in an area, which enables you to be able to train other medical students and doctors. So that's the peak. That's the highest level you could attain in the profession. For the professor to be treated that way is absolutely reprehensible. So having said that, we need to observe a pattern, especially as it has to do with our health sector. I'm really scared. Right now, private hospitals advertise for positions and do not find, especially specialist position, and they do not find people to even hire. Yeah, it's getting there. We may get to a point, if care is not taken, where people will begin to travel a very long distance to carry out within Nigeria or even possibly travel out of the country for simple general surgery procedures like herniorrhaphy, appendectomy, that removal of appendix in the case of appendicitis, or even lump removal. These are general surgery procedures that are considered, minor. We might soon get to that. We have acute shortage of healthcare professionals, not just medical doctors, even nurses, medical laboratory scientists, physiotherapists across board. But it's hitting us in the face. I saw a colleague at National Hospital recently, Dr. Tosin. He was a colleague in medical school, and I had to thank him and say, Dr. Tosin Ajibade, thank you for staying back to help improvise, meeting the health needs of our people. And he smiled. He's like, yeah, he tends to be getting a lot of that these days. I say, yes, it's worth it. Because we know the conditions which you work. You know that you have the choice to make that decision, if not for yourself, also for your family. Take them to an environment where they will not wake up every day and be hearing news of kidnapping, beheading of people, and all kind of crazy things that happen here. So we need to celebrate our health workers. We need to encourage as much as possible, and we need to make it more appealing. The JAMS result this year, they brought out the names of, I think, the top 10 highest scorers, and none of them applied to study medicine. That's not the previous pattern. It's not as if less intelligent people, of course, JAM score alone is not the only metrics to measure how academically brilliant someone is, but, at least nobody that is less brilliant will score high. They're not studying medicine. It's a pattern. There, you could see software engineering, you could see a whole lot. So there's some shift. And even those who are studying, a lot of people are studying to Japa to live because that's an easier stuff to use and leave this country. In terms of the medicine, nursing, especially. So we need to make our still work. We need to address a whole lot of issues. We need not to descend further to get to a point where we travel long distance to do simple proceedings or a medical procedure where you have to wait for a very long time to get attention. It's already happening. You only need to have a health emergency in any part of this country to understand what's going on. This election season, we need to make it a campaign issue. We need to make demands. We need to ask questions on how each of the candidates want to help to make our house to work. See you another time. Bye.